Hello everyone and welcome to this audio podcast. In this series, the Labside Archetype Edition. This is an audio podcast as part of as part of a radio edition, another radio edition as part of a radio edition, and a an audio podcast as part of a Bostix Blast, and an audio podcast as part of another Storm Robotics production. In this audio podcast, there'll be an overview in around works from in around an overview in around a review of works from 2016, and looking at can social media reduce discrimination and ignorance towards patients with long-term conditions, and using a chronic kidney disease example, a CKD example in context of the in context of the United Kingdom or the UK. And this works was co-developed between various colleagues and collaborators, and originally was works that was presented at the International Pediatric Nephrology Association meeting, or IPNA meeting, the International Pediatric Nephrology Association meeting in 2016. And so the overview is as follows. So long-term conditions or LTCs are increasing in prevalence increasing in prevalence and cost in Western healthcare. Patients with such conditions are often classed as disabled because of impacts on self-care, activities of daily life or on daily life, or secondary consequences of conditions such as impairments affecting factors such as mobility, concentration, and communications. Disability needs are often ignored in the design of services or healthcare services and in treatment of individuals. It manifests as services which some find difficult to use, and lack of personal regard or respect, which then leads into discrimination, and often based on lack of understanding by the healthcare profession or healthcare professionals itself or themselves, which leads into ignorance. This paper explores how social media an example in context of assistive tech or assistive technology in an increasingly digital age might help. The focus is in around CKD or chronic kidney disease, with two specific illustrations in the two specific examples or illustrations in context of the United Kingdom, beginning to which have and began to highlight varying perspectives between the organizations or social media platforms from 2009 and 2000 and from 2014, international from an international basis. Support mechanisms are now emerging or have been emerging, may go well beyond healthcare, and even beyond going on beyond renal or kidney or nephrology problems. They may often they may also find at the same time, healthcare service users may also find additional assistance through the New English Accessible Information Standard, in the English Accessible Information Standard, which this works had also delved into. So certain terminologies in this works had certain terminologies in this works include discrimination, ignorance, disability, long-term conditions, social media awareness, assistive technology, and communication. And these terminologies can be used in search engines to identify literature or papers, or identify papers similar to this works. So that draws this audio podcast to a close. And this audio podcast has been part of the Labside Archetype edition, part of another radio edition, radio edition under Storm Robotics production. And this has been an audio podcast as part of a Labside Archetype edition, and part of a Labside Alchemy. This is another audio podcast, an audio podcast as part of a Bostics Blast. Thank you for tuning in.